Well, I think one of the pervasive themes that's happened probably in the last decade, maybe 15 years in joint replacement surgery has been this concept of medical optimization for surgery. And I think, when I started, out of training, the concept was clearance for surgery. Medical clearance and medical optimization are two things. Clearance means, oh, you got low risk for surgery. Optimization is, well, maybe you're low risk, but can we actually lower your risk a little bit more? And we favor the latter approach now as opposed to the former approach. The former approach was, yeah, you're good enough to undergo surgery. Now we want to know, well, you're good enough to undergo surgery, but can we actually make you better? Because there are known risks going into surgery, and if we can reduce those by even a 0.5%, we help a lot of people. And that's what's the concept that's been going on over the last decade in my practice. And what you'll commonly hear when you come into a consultation with me is we'll talk about what we call modifiable risk factors. And modifiable risk factors are things that are easy. I mean, these are things that you do in your daily habits that may or may not impact directly our surgical care. And these would be things like smoking, right? Obviously, nicotine's got its downsides. Nicotine impairs blood flow. It increases the rate of infection. It reduces healing rates. All of those things are well established. So obviously, that's something that we're going to address if it's something that is in your history. Weight, it doesn't mean that we don't take care of heavy people. I pride myself on taking care of all people and even heavy people. But if we can modify some of the risk, i.e. get a weight loss program in place, make sure that we are going the right direction and using what we call a multimodal approach with a lot of different angles going on simultaneous to address the risk. Because commonly, for example, with weight, we see things like diabetes. Diabetes, if poorly controlled, there's this thing called a hemoglobin A1C, which is an indirect measure of somebody's control of their blood sugar over time. And we see that as you have increasing hemoglobin A1C values, you have increasing rates of infection. So things that we can do to lower the hemoglobin A1C, make sure people are good candidates for surgery at the time they undergo surgery, that's going to help a lot of people. And that's one of the things that I credit for our very great outcomes, is that we really do a good job of optimizing people before surgery. Downside of that medical optimization is I sometimes have to have uncomfortable discussions with patients, and that's the frustrating part, because I don't want to be perceived as unfeeling or uncaring, but sometimes you have to discuss the challenges that a patient's going to face. And it's not that I don't want to help you. I want to help everybody, but sometimes we need a little more time to get things better for a person to make sure that they have the outcome that they want.